Hello everyone and welcome to this audio podcast. This audio podcast is part of a Segmental Scruples series or edition. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, a little bit in around looking at research, looking at sort of the research perspective or research aspects around in around this series of the need or requirement to consider renal health in transfusion care practices the renal health in transfusion care practices to inform best practice or best practices. So research has certainly advanced in supporting patients or recipients with long-standing conditions or chronic illnesses, especially in regard to sort of the ready-to-use protocols or procedures such as erythropoietin or EPO and alternative forms of RBTs. There is still quite a gap in research, and this mainly focuses on patient management in around PBM or patient blood management in at least in amongst the short-term aspects in amongst the sort of the short-term aspects of sort of guide in around the guidelines the question is then what should be done better. So this is a question that can only really be answered by carrying out conducting sort of more longitudinal investigations that look to compare different forms of treatment alternatives over time. And there is a requirement to explore sort of supplementation with adjunctive agents such as iron, folic acid, and vitamin B12, for example, which also has some advantages. Use of EPO the use of EPO substitutes to an extent in untransfusible recipients and may provide an alternative to RBTs and or blood products, but in emergency cases, RBTs cannot be replaced in terms of volume and replenishment. Several investigations indicate that the use of more stringent triggers for hemoglobin less than 100 grams per liter or less than 100 grams per liter, for example, these do not appear to adversely affect patient or recipient outcomes. And at the same time, research seems to continue to neglect, for example, renal function when it comes to transfusion guideline and practices. And this is an ongoing general general issue. Feasibility or pilot investigations in a group of patients or recipients with different long-standing conditions, chronic illnesses, who are perhaps prescribed RBT routinely, are required to understand and appreciate whether in the longer term they actually would be more advantage from having other forms of replacement treatment options. Future research or prospective research must also link to renal guidelines, which would be the first sort of basis for scientists who have an intrigue in this area and can help gain more understanding in regard to what formally constitutes as chronic kidney disease, CKD, and or renal insufficiency. That draws this audio podcast to a close. This audio podcast as part of a Segmental Scruples edition and or series. This audio podcast as part of a Rampage Sonar, this audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.